Good evening, everyone. Distinguished guests, dear friends, it is truly my pleasure to open this award ceremony celebrating the European Civic Prize on Chronic Pain. I would like to commend all the participants for their contributions to this research project, aiming to collect good practices upon which the European Civic Prize on Chronic Pain has been established. On the other hand, I would like to take the opportunity to congratulate the recipients of this award. Let me also take this opportunity to thank all of you for your many years of work, forming new connections among different organizations, sharing best practices, and for organizing this symposium to continue to raise awareness about chronic pain and its effects. Thanks to the work of the 6 main organizations facilitating this event and your collaborators, we are sending a powerful statement through this symposium about our united commitment to safeguard the well-being of all people living with chronic pain. In my various meetings with members from the ME, CFS, and Fibromyalgia Alliance, an NGO which is actively advocating for chronic pain sufferers in Malta, I have had the opportunity to hear firsthand experiences of people living with such conditions. Through my connection with members from this Maltese Alliance, I have learned that when our healthcare systems are unable to provide effective outreach and sustained support, many sufferers feel that their quality of life is diminished, while their families, communities, and the whole of society are also very negatively affected. I believe that the issue of chronic pain must take more importance within our healthcare systems and policies, both nationally and at the widest possible European levels, to continue to push for proactive and effective change. Creating and sustaining further connections between civil society activists from around the world will highlight even more the vast numbers of people who are being effective. I'm convinced that it will also create a spirit of solidarity among sufferers, their families, and other members of society. Indicators from the International Association for the Study of Pain and the European Pain Federation state that 1 in 5 people suffer from moderate to severe chronic pain. Furthermore, 1 in 3 are unable or less able to maintain an independent lifestyle due to their pain. The effect of the pain also means that 1 in 4 people report that their relationships with family and friends are severely strained. According to Professor Harold Breivik, former president of the European Pain Federation, and I quote, "Chronic pain is one of the most underestimated healthcare problems in the world today, causing major consequences for the quality of life of the sufferer and a major burden on the healthcare system in the Western world," end quote. Speaking about fibromyalgia, specifically, data from the World Health Organization says that its prevalence is between 3 and 6% of the global population. These indicators should convince all across the world to work together in greater synergy across civil society and diverse medical sectors to encourage greater awareness. However, civil society must also continue with their efforts to push authorities to take action on behalf of all people who live with chronic pain. For example, I believe that a European-level policy should be drafted to specifically target these concerns. People living with chronic pain are not only dealing with the pain itself, but also with uncertainty, discomfort, and confusion. Often sufferers report feeling overwhelmed when they are dealing with the situation. These factors can all contribute to a disabling effect on the individual, who is regardless expected to continue to function in their places of work, their communities, and their societies. I believe that there is still a worrying lack of respect and understanding for people living with chronic pain. This is a cause for great concern. Therefore, I believe that we must, first of all, encourage more knowledge about the underlying challenges faced by people living with chronic pain. This means looking at the problem of ableism within our societies. As many of us know, ableism refers to the practices and the prevailing attitudes which are present in our communities and institutions. These practices and attitudes often devalue and limit the potential of persons with disabilities or people living with disabling conditions, which could also be an invisible disability. We must raise awareness about the fact that our healthcare systems, institutions, and policies are not always responding in an adequate and effective manner to the legitimate needs of people who are living with disabling conditions. Such a situation means that many of our public and private places, services, education, and social outreach are not fully inclusive. Indeed, they can become a source of exclusion, making it difficult for us to achieve the full and equitable participation of all citizens, including those with disabling conditions. This reality is often invisible to those who do not have disabilities or disabling conditions, or to those who are not yet sensitive to these issues. Pain is a worldwide problem. Global indicators from the World Health Organization assert that 20% of adults suffer from pain, and 10% are newly diagnosed with chronic pain each year. Moreover, studies tell us that women are overrepresented among these indicators. Such challenges are of particular importance when we talk about the experiences of women and minority groups who are primarily affected. There is a lack of research on chronic pain worldwide, and this is particularly evident in the Maltese context. The first qualitative study conducted in Malta to focus on the voices of women with fibromyalgia was carried out in 2015 by Angie Kirkhope-Colero. The study, entitled Working with Fibromyalgia, the lived experience of women with fibromyalgia in the workplace, states that although many affected women said that they were reluctant to be perceived as disabled, fibromyalgia has clearly disabling effect on their lives. Let me quote from this study, where women said that it was a burden not just to them, but also on their families. Thus, they believe that gaining disability status can provide them with some form of official recognition as well as financial aid. End quote. Furthermore, an international study entitled Defining Racial and Ethnic Disparities in Pain Management, which appeared in the Journal of Clinical Orthopedics and Related Research, states that, and I quote, racial and ethnic minorities consistently receive less adequate treatment for acute and chronic pain. End quote. Racial or ethnic minority individuals living with issues of chronic pain need to be empowered to seek and receive appropriate support and care. It is essential that the medical professionals who are treating such individuals are aware of their own attitudes and potential prejudices, which may be making the problem for the sufferer more difficult. There must be more emphasis to develop strategies, and again, I quote from the study on defining racial and ethnic disparities in pain management, that we must do more to overcome unconscious but potentially harmful negative stereotyping of minority patients, end quote. These facts point out to the complex realities experienced by chronic pain sufferers and the need to deal with them in an intersectional way. We must ensure that gender and racial or ethnic background inform the way authorities formulate and implement their policies. I believe that stronger synergies between civil society and medical professionals would be a powerful catalyst to highlight these intersectional concerns. I also believe that such synergies can also encourage authorities to acknowledge the disabling effect of chronic pain and to respond accordingly across institutions and public services. We must promote issues of chronic pain as a matter of urgent importance, including to the medical community. I believe that due to the effects of ableism, we must do more to create a necessary social and cultural change through education and awareness in our attitudes towards people living with chronic pain. We must also emphasize the disproportionate number of women who are living with conditions of chronic pain and the particular challenges faced by minority groups in assessing necessary support and care. Finally, we must assert that chronic pain is an issue of relevance to public health. We must assert that authorities, including the European Union, should incorporate chronic pain into their strategies for effective outreach across our societies. In conclusion, let me once again congratulate all the participants in this research project and today's award winners for their substantial contributions to the strengthening of this sector. I hope that you shall continue to collaborate and produce timely and relevant good practices and policy recommendations which reflect the real experiences of people living with chronic pain. Let us keep emphasizing that we need to act now. In the words of popular author John Green, who is himself a chronic pain sufferer, I quote, "Language is always inadequate in the face of pain." End quote. However, we must keep trying as best as we can to create empowering spaces for people struggling with chronic pain to give a voice to their narratives. It is sometimes impossible to accurately convey the intensity and the impact that chronic pain can have on the lives of the sufferers and their families. Sometimes words fail us, and it is in those moments that we must show the most solidarity and support. We cannot allow anybody to feel alone, isolated, or ignored with their pain. We must work together to continue improving our institutions, communities, and societies, ensuring that they respect the experiences of all. They are truly inclusive and fully participatory, and that they celebrate the dignity and the potential of each and every person by putting in place the necessary good practices and policies in our healthcare systems. Thank you for your attention, and bon appétit.